back to school. It's an important issue and one that we've all taken to heart, as its ripple and reach touches all of us. People are passionate, understandably so, about what should be done. They're anxious about what's to come, angry even about what the Omicron variant has taken from all of us when we've already sacrificed so much. Believe me, I don't blame you. I'm feeling it too. Even more so with this wave than in the past 2 years. It's been weighing heavy on me. For every soccer practice or hockey game missed, for the pivot to online learning, be that for school or for other activities, I feel that my kids, your kids, all of our kids are losing something valuable every single day. It's a cruel robbery of experience, of building friendships, and coming in to who they are, who they want to be. As parents and guardians, we all feel that the safety of our kids must come first. There are many opinions out there about what that means and what should be done. This type of division just stokes fear, and there's already enough of that going around. We need to follow the evidence and be united in the fight against the invisible enemies of biology and psychology. We cannot and should not ignore the fears, but instead meet them head on with fact. Today, with the advice and guidance of that facts, Dr. Fitzgerald and her team will be moving forward with a plan to reopen schools for in-person learning on Tuesday, January 25th. This was not a decision made lightly by Dr. Fitzgerald or her team. It is, however, the right decision for our children at this time. As we've seen across the country, over 97% of students are now in school. But as we have learned, the situation can change. And rest assured, we are watching closely and will change too if needed, as we always have and shown that we will throughout this pandemic. Unfortunately, my friends, this is life with COVID-19 right now. There is no doubt that despite the best plans, there will be disruptions. But like we have so far in this pandemic, we must be united and recognize that while these disruptions may be an eventuality, they will not defeat us. Our children deserve our best effort, and I'm confident that the hardworking women and men in our schools, the teachers and support staff alike, will deliver as they have throughout the pandemic. I'd like to take a moment and thank Dr. Critch and the Canadian Pediatric Society for sharing a letter supporting the return to in-class learning in Newfoundland and Labrador because it's best for our students. After all, this is about the safety and well-being of our students, our future. Rapid tests are one measure we have brought in to help minimize disruptions, and they've been making their way out to families. My friends, we all share a sense of responsibility here as parents, guardians, teachers, administrators, as Newfoundland and Labradorians, to do our part. Get the jab, follow the guidance, take the tests, lower contacts, wear masks, do your part to help reduce the spread of COVID-19. All safety measures are in place. We were ahead of most in securing HEPA filters before the September start to school, and we are way ahead of others now with 75% of our 5 to 11-year-olds with 1 dose and over 70% of teachers fully boosted with 3 doses. Close to 100% of teenagers have at least 1 dose of the COVID-19 vaccine. Despite that, still, I know there are parents out there who are scared. And frankly, when it comes to your kids, there's no amount of comfort I can provide that will give you full peace of mind. Please know that as a parent with a child with asthma, I too share that fear. But I promise you, I always will put all of our kids first. All of us here on this panel have and will continue to do so. Otherwise, all the sacrifices that we have made will be for nothing. And frankly, none of us want that. With that, I'll turn things over to Dr. Fitzgerald for an update and for the plan. Dr. Fitzgerald.
Thank you, Premier. Thanks, everyone, for joining us today. So we now have 20 people hospitalized due to COVID-19 severity, and there have been 764 new recoveries, leaving 2,801 active cases in the province. Since the update yesterday, we're reporting 360 new confirmed cases of COVID-19 in the province. 212 are in Eastern Health, 63 in Central Health, 57 in Western Health, 23 in Labrador-Grenville Health, and 5 that are waiting on region confirmation. 1,462 tests were completed since yesterday, with over 462,500 tests completed to date. Sadly, we are also reporting 2 new deaths today due to COVID-19. This brings our total deaths from COVID-19 to 30. I offer my condolences to all of those grieving the loss of their loved ones at this time. We continue to assess our level of restrictions, and the province will remain in alert level 4 for the time being while we transition children back to school. We are, however, making adjustments to restrictions for travellers, and effective midnight Friday, anyone entering the province will still be given the package of 5 take-home rapid tests. However, fully vaccinated travellers can leave isolation after receiving negative results from 2 rapid tests taken 24 hours apart. They are then required to continue testing for the remaining 3 days after leaving isolation. On Tuesday, as the Premier said, children will return to in-person learning. And I know this comes with mixed emotions, and I certainly appreciate all the different perspectives from students, parents, and staff. My most important message today is that we cannot let fear guide our decisions. We have always relied on evidence to guide the way, and it is through a careful review of the evidence that we have assessed the risks and benefits of returning to school. One of the most important lessons that emerged from this pandemic is how important school is for children, not just for their academic well-being, but also for their physical and emotional well-being. There are also a range of impacts for children being out of school. We are concerned for vulnerable children that rely on schools for specialized services and supports, as well as consistent access to food and physical activity. And as heartbreaking as it is to say, we need to acknowledge that there are some children living with violence, and school is their safe space. We are also concerned with the increased mental health impacts on children and youth, and the lack of routine, social isolation, and concerns about the pandemic in general fuel anxiety and depression. And there are also impacts for parents that are unable to work in order to be at home with their children. We have looked to experts in pediatrics, such as the Canadian Pediatric Society, and we found overwhelming evidence and support for schools to open for in-person learning within the current environment. One of the most common questions we have received around the timing of school is around the timing of school opening and vaccinations. So over 93% of students aged 12 and older are fully vaccinated, and almost 75% of children aged 5 to 11 in our province have had their first dose of vaccine. This will provide a significant level of protection in these age groups. Today, we will start administering second doses to children who have reached the 8-week mark since their first dose. That's the 5 to 11 children. However, it will be about 6 more weeks before the majority of children in this age group can be fully vaccinated, taking into account the 14 days that it takes for the vaccine to become fully effective. 6 weeks is too long for us to continue the suspension of in-person learning. Studies from Canada and the United Kingdom show that the risk of severe disease for children is very low. A COVID-19 infection with Omicron generally presents with mild symptoms in children, even milder than in previous variants such as Delta. COVID is circulating in our communities, and we will see that reflected in schools. Our system can withstand a rise in cases among very low-risk age group. At this time, the benefits of being in school for children outweigh the risks of COVID-19. Again, I certainly appreciate that this may be worrisome for parents, but this is an important part of learning to live with COVID-19. We should also remember that children see when we are afraid, and they often carry our anxieties on their little shoulders as well. We need to learn to talk to our children about COVID in a way that removes fear from the conversation. The school districts have multiple layers of precautions and protections in place to help control the spread of COVID-19 in schools. First and most importantly, if your child develops even one symptom of COVID-19, do not send them to school. Follow public health guidance on testing and isolation. In school, class cohorts should be maintained as much as possible for elementary and junior high. Staff and students must wear their masks at all times indoors except when eating, and masks are not required outdoors. Where weather permits, physical education should happen outdoors. When physical education is indoors, masks can be removed during vigorous physical activity, but we encourage trying to keep them on as much as possible. We are recommending 3-layer masks, and if you don't have a 3-layer mask, you can apply more than one mask to make up 3 layers of protection. Medical masks are also acceptable. We have also introduced the rapid testing program to help detect a COVID infection before a child returns to school. Students are required to have their 2 tests 72 hours apart before their first day back to school. Please ensure that you follow the instructions exactly and make sure you compare the test strip to the examples in the instructions to be sure you are reading the lines correctly in the right place. I also ask that you do not waste any unused rapid test, as these are a limited resource right now. And while we are not asking parents to report the results, this program is required. We are asking parents to do the right thing and help us to reduce the risk of COVID spread as students start back to school. I'm confident that the vast majority of families will do their part to help reduce the risk. I will note that there is a window of time after recovery that a COVID-19 test may show a positive result from an old infection. For a rapid test, this window is 21 days after symptoms started. So any student in this 21-day time frame does not have to complete rapid tests to return to school. We are also providing take-home rapid tests for staff and children aged 2 to 5 in regulated childcare. This program is for anyone in childcare with mild symptoms of COVID-19. Children attending both school and childcare will be receiving their kits from the school and not the childcare centre. Throughout the pandemic, our goal has been to reduce the amount of severe disease and death from COVID-19, while minimizing the effect on society as a whole. Omicron has shifted the balance to the point where the impacts of some restrictions outweigh the risks of harm. We have already made adjustments to the management of cases in terms of isolation time, and now we will be making changes to the management of contacts. Again, we do so taking into account the best available evidence while minimizing the impacts on society. So effective Monday, people that live in the same household as a person that has COVID are considered high risk regardless of whether the individual with COVID is isolating away or not, and this includes sexual partners and couples that do not live together. Non-household contacts are considered moderate risk, and there will be different isolation requirements depending on the risk category and vaccination status. To be clear, there is no change to the isolation requirements for anyone with symptoms. If you are high risk or moderate contact and symptomatic, you are considered to have COVID-19. And while there are too many scenarios to go into here, we will have information on our website soon detailing this new guidance. I do, however, want to share with parents and educators what to expect when school resumes. We want to minimize the disruption for children in school as much as possible. So if a school-aged child that is not fully vaccinated is a non-household contact and does not have symptoms, they can return to school, but must isolate when not attending school for 10 days. Given the school-based precautions in place, such as masking and cohorts, and because the child has no symptoms, the risk of transmission is lower and therefore the child can return to school. If a household member of a child that is not fully vaccinated has COVID-19, the child is a high-risk contact and must fully isolate for 10 days before returning to school. For adults, anyone fully vaccinated and having no symptoms who is a non-household contact can proceed to work or school, but must isolate at all times when not at work or school for 7 days. There are also high-risk situations where this will not apply, such as those that work with vulnerable populations. Anyone asymptomatic, without symptoms, and fully vaccinated that has a person with COVID-19 in their home must fully isolate for 7 days before returning to work. I strongly caution against using the reopening of schools as a guidepost for other activities. School is essential. We will see a rise in cases when schools reopen, and we are willing to accept that so that children can be in school. We need to balance the rise in cases resulting from school exposures by limiting spread in the community. We will adjust restrictions only when the epidemiology permits, and our plan is to take this in steps. This strategy will help us keep schools open by keeping cases at a level that the province can manage. We need everyone to continue keeping their contacts low. The fewer people interacting in high-risk settings, the less chance the virus has to spread. We continue to assess the alert level on a weekly basis, but for now, we will remain in the modified alert level 4, and all restrictions remain the same. We continue to ask employers to permit employees to work from home where possible. We also ask that parents not bring together students from your child's class unless they are in each other's tight 10. We are minimizing the risk in school as much as we can, and we would consider informal gatherings, such as a birthday party, for example, outside of the school to be a higher risk for transmission. We are not quite ready to resume group and team-based sports and arts activities where individuals cannot physically distance at all times. Such activities increase the risk of spread, and they also increase the number of non-essential, close contacts each individual has outside of school, work, and their tight 10. Again, we will reassess this on a weekly basis with the alert level. In previous waves, we eased restrictions when there was no longer indication of community spread. In this wave, restrictions are somewhat like a dam on a river. When we ease restrictions, cases will rise, and when we restrict, cases will decline, but we cannot eliminate community transmission. This is not the COVID of 2020 or even 2021. The Omicron variant has changed the game entirely due to its rapid and efficient transmission and short incubation period. The virus moves well beyond the speed of traditional contact tracing. This is a reality that no one can change. We must adapt. We do this by adjusting restrictions to allow society to function as much as possible while keeping the spread of the virus at a manageable level and reducing the risk of severe disease in those individuals that are at higher risk for severe disease where we can. Navigating COVID is a constant balance, and that has never been truer than right now. There's no perfect solution, and we need to remember that our goal is to reduce transmission where we can so that essential activities can continue. This responsibility lies with each and every one of us. You have put your trust in the public health team for the last 2 years and risen to the challenge of COVID again and again. When we put restrictions in place, you listened, and when we asked you to get vaccinated, you made us the most highly vaccinated place in Canada. And you have the power to get us through this too. So remember, individually, we are all each just one drop of water, but together, we are an ocean. And as we all know here in Newfoundland and Labrador, there's nothing more powerful than the ocean. So hold fast, hang in there, and take care.
Well, thanks, Dr. Fitzgerald. I'll now invite some comments from Minister Haggie. Minister?
Thank you very much, Premier. Just to reiterate a little bit of what Dr. Fitzgerald said, summarising her changes and the public health recommendations around isolation and testing. These can be found in the form of flowchart on our website, and they will be up there later on today. And it's a lot easier to see. Some of us are more visual, and certainly myself is one of those. Found those flowcharts extremely helpful, and they would guide parents and adults through the challenges, the navigation, as Dr. Fitzgerald said. With regard to tests, I can provide a little bit of an update on rapid tests. Our use of these is very targeted. These are a scarce resource nationally, and they're a scarce resource globally. We have deployed them on the advice of public health to deal with very targeted areas. So points of entry, that have been referenced already, schools we've heard about and the families there, long-term care and personal care homes, and also you heard referenced daycares as well. The federal government have informed us that our share of the 140 million, which is just under 1.3 million, will be arriving here over the first 2 weeks of February. Given our current burn rate, that will enable us to carry through the arrangements we have in place, certainly until the end of February. We are sourcing additional tests of our own, rapid antigen tests of our own, and obviously the federal government will be continuing their efforts in supply chain. So we have to use these wisely, and I would echo Dr. Fitzgerald's comment about husbanding and being careful with your unused tests, because they are of value to you in the future. In terms of the PCR test itself, we heard in previous weeks that there was significant delay, and we did have some major challenges there. Those have, thanks to the hard work of the staff in both public health and the laboratory service and public health laboratory, we are now down to 24 hours from test swab to result online. And I would like to thank those healthcare workers who have worked so hard to get that under control. So again, hold fast. The one thing you can do is to get your boosters, to get your shot, and to take your 5 to 11-year-olds when their appointment comes up to do that. And the RHAs across the province have painted clinics for vaccine right out to the reopening of school, and will, once schools reopen, resume vaccination in schools. We certainly found that very valuable, and I think just under 50% of the 5 to 11-year-olds received their shot while in school. So we hope to boost that even further in the coming weeks. So with that, Premier, I'll hand it back to yourself. Thank you.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. Today we have 6 reporters joining us. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. There will then be a final round where each reporter will have the opportunity to ask one final question. Our first questions today are from Peter Jackson with The Telegram. Peter, please go ahead.
Thank you. Good afternoon. We had a recent story about a principal who made it seem like rapid tests were really just optional, which sort of belies the fact that there's no way of actually monitoring them. I realize that your exhortation to parents are to not to succumb to fear are fine, but what do you suggest, Dr. Fitzgerald, to parents who decide that with all this conceding that we're all going to be getting more COVID cases, who just decide that they have to take their kids out of school?
So I think that, every parent has to make the decision that they feel is best for their child, and nobody knows their child as well as a parent does. So, I think there's lots of things to consider when you're making that decision. And, if your child has medical issues, that's another thing, and that's a conversation to have with their healthcare provider as well. But I think that, our message today is that we know this illness is mild. We know in this age group, we know that certainly in the older age group that we've got really good protection with the vaccine. We know that the vaccine protects really well against severe disease. So yes, you may send your child back to school and your child may get COVID, or someone in your child's class may get COVID. But by and large, at this point, the evidence is very strong in saying that that disease will be mild, and that disease, that your child will do well, even if they get COVID. So I think we have to keep that in mind. We have to do all the things that we can do, all those protections that are in place. We have to continue to do all of those things. And, get your child vaccinated when you can. So if your child is in that 5 to 11 group and you haven't gotten them vaccinated yet, make the appointment, get them vaccinated. It will protect them. And if they've gotten their first dose, please get online and book 8 weeks out to get their second. We know that the 8 weeks gives us the best protection for the longest period of time right now, so that's still what we're recommending. But, there are still lots of things that we can do to feel safe going back to school.
Thank you. Just to follow up to Minister Osborne, if you were is there any kind of a threshold in terms of the number of people going back? You have the NLTA now asking for delay. Is there a contingency plan at all if the numbers are not up to where they need to be?
Thank you, Peter. I'm not sure if you're referring to the numbers of students or the numbers of staff, but we have...
Both.
Okay, so in terms of staff, we've worked with the NLTA, the Dean of Education, and I want to give a shout out, a thank you to the Dean of Education and the faculty. We've worked with NAPE and CUPE to ensure that we have a contingency plan in place, and I know Tony Stack can speak a little further to this as well. But through the Faculty of Education, there are some 205 Bachelor of Education students. The majority of those have already spent a minimum of 25 days in the classroom. The Faculty of Education feel they are ready, prepared, equipped to fill in if need be. We also have the ability to reassign staff who are qualified educators, and we've had cooperation from the sponsor body at the Teachers' Pension Plan to allow us to move from the 90 days to 180 days, where a retired teacher can continue to collect their pension and collect the salary. Though all of these things will help increase the substitute pool. We've also got contingency plans in place for custodial workers and bus drivers, and I'll ask Mr. Stack to speak to that a little more. In terms of student population, whenever we've come back from an online session anywhere in the province, we do anticipate that the first number of days the student population may start out a little lower. It will build. We fully anticipate that the majority of students will be back in class, and hopefully on the first day. This is a shared responsibility, and I understand the anxiety that parents may feel, but as Dr. Fitzgerald said, in this age group, the symptoms are mild, and the Canadian Pediatric Association have given very compelling reasons based on isolation, mental health, social well-being, in addition to the academic challenges that students face by not being in class learning. Tony, did you want to add in terms of the contingency plan for custodial and other staff?
Thank you, Minister. With respect to teachers, first of all, we will completely exhaust our substitute teacher supply of 1,100 as a first course of action. We also have the ability to take folks like teaching and learning assistants, should they hold education qualifications, and promote them into a replacement position. There are also, if there's no regular substitute available and you've done the assignment of the teaching and learning assistants, you can access retired staff, and the adjustment with the teacher's pension plan is a good move. It will allow us to have access more retired individuals. And you also referenced the case of the Faculty of Education students. There's about 130 of them who are placed in our system right now, understudying teachers. So we can convert those to substitute teachers if they're amenable to do so. And then after all of those measures, there is the ability to reassign staff within schools. And principals are well aware of that, and they're quite accustomed to doing that in certain situations. We've experienced that periodically in isolated areas around the province. With respect to casual staff, look, anybody wants to sign up, for a job. We have many jobs available for casual fill-in personnel. And we will approach recruiting efforts. We talked to the unions about the protocols around taking day staff who may be unavailable, promoting night staff, extending hours, adding to our casual list, and even exploring the option with the public service pension plan of making it amenable for some of the casual or retired personnel to come back if they want to operate a bus or work in one of our classroom support personnel for casual work. So all of those things will be exhausted. I think with the public health measures, the way they've been outlined, the staffing pressures will be mitigated to some degree, and it is our aim and objective to keep schools open for every child for as long as possible, and I think we can achieve that. With respect to students, if there is some apprehension out there, but I want parents to understand this, that we have the ability to support those students who, because of medical reasons, may have to isolate. We can support them with a degree of continuity of learning plan. It won't be as robust as virtual learning, but there is some ability to do that. But for every child that stays home for non-medical reasons, it does put added pressure on the system, and it will be difficult to support children in that situation. We'll do our utmost. Schools have turned themselves inside out. That would create a lot of added pressure. So we really hope that parents, children avail of the fact that school is open, school is safe, and it's the best place for you to be for learning right now.
Our next questions are from Peter Cowan with the CBC. Peter, please go ahead.
Can you explain how contact tracing is going to work? So let's say there's a student who has been in class. They test positive either on a rapid or on a PCR test. Who's going to get notified? And with these changes in isolation requirements, does this mean that other students in the class wouldn't have to isolate and could continue to go to school? How's this going to work?
Yes, so what will happen right now, so if you have somebody who has a positive rapid test, then they have to notify their contacts, and that will be outlined as it is right now on the website. There will be information to that they will have to follow, but that information will say that students who are only contacts in school and not contacts out of school. So if they're not, a friend who normally plays with the child, then those students who are only contacts in school will not be considered and not be contacted, or don't have to be contacted, and those students would therefore be able to attend school.
Can you explain the rationale for this change? Is this mostly about the evidence, or is this around the fact that there would be many classes where a lot of people would end up being out of, and the disruption that it would create?
So I think, as I said, our goals here, we try to follow the evidence. We always have tried to follow the evidence to, as best as we can, and we've used that evidence to inform our decisions. What we know is that COVID going forward is going to look different than it did in our rearview mirror, and so we need to adjust to deal with that. The evidence right now is saying that children have less severe disease, and that we know that vaccination will reduce transmission to some degree. It's not as good as with previous variants, obviously, we know that, but it does reduce to some degree. And the fact that children are in school, and with the safety measures that we have put in place, with masking and cohorting, that will reduce spread. We also have a symptomatic testing program in place where children, if they get symptoms, can test themselves with a rapid test. So we're hoping to reduce that, the introduction of disease into the schools. So we're trying to take that evidence and balance it as best we can with limiting the impacts and the evidence that we have that support children being in school as much as possible. So it's a fine line that we're walking, and it is a delicate balance, but we are trying to get there. This is really, I think, a transition period to living with endemic COVID. And so when COVID is just a part of our natural landscape of infectious diseases that we deal with all the time, like flu, like RSV, which is another respiratory illness that it's very common in children, and other viruses that we pick up all the time. So, it is a transition. It's different than what we have done before. We're dealing with a different virus than we have dealt with before, and we have to adjust to account for that. And the impacts on society are important as well, and we have to balance those harms as much as we can.
Our next questions are from Richard Duggan with VOCM. Please go ahead, Richard.
Thank you. This question is for either Minister Osborne or Tony Stack. I'm wondering if there are going to be any additional testing protocols put in place for substitute teachers, given the fact that in a given week or 2 week period, they could be interacting with several different school communities.
I can start that answer, and then Dr. Fitzgerald may want to respond as well. Substitute teachers will have access to the rapid test kits, as will bus drivers, for example, student assistants, and other school staff. The list goes on and on. So if somebody hasn't heard their name, it doesn't mean they're not included. But the substitute teachers will have access to the rapid test kits. The best person to explain how they would use those test kits, I believe, would be Dr. Fitzgerald.
Thanks, Minister. So, if someone was a substitute teacher who was going back to school right away, we would certainly want them to follow the back to school protocol. Otherwise, they would have the test to use as per the symptomatic protocol that we follow. So if you have symptoms, you do a test, and you aren't available, unfortunately, then until you do the second test, if that test is negative. If the test is positive, well, obviously your case COVID, and you have to be treated accordingly. But for substitute teachers or anyone else, that process would be followed. The symptomatic process would be followed.
And Minister Osborne, I was speaking with opposition education critic Barry Pettin yesterday, and he was pushing for a hybrid model to be introduced to accommodate parents who don't feel comfortable sending their kids back to the classroom just yet. Why not include something like this in this return?
So I'll start the answer, and I'll ask Mr. Stack to respond as well. We tried the hybrid model last year, where we had students, half the students at home and half the students in class. Teachers weren't particularly fond of it. Students weren't fond. Parents weren't fond. The students that were at home were not getting the same attention as the students that were in class. It didn't work as well as either online learning or in-class learning, and we all know the risks of isolation and so on of students online learning. The best place for children to be is in the classroom. I'll ask Mr. Stack to add some additional commentary about the hybrid model.
Thanks, Minister. Correctly, it was very difficult to try to do both the in-person learning and then have a virtual component simultaneously. Very challenging. There are a finite number of teachers. We've allowed for the children to go back to school where they should be, and that is the learning mode right now. There's not enough staffing available to be able to do both. If you had a significant number of students online, it would be a real challenge. So we're focusing on the classroom. The teachers have done a great job in the virtual setting, but there are limitations, and now they have to focus on the face-to-face component, and that's what we'll be doing in the days ahead.
Our next questions are from Rationale with All Newfoundland Labrador. Go ahead, please, Rationale.
My question is for Dr. Fitzgerald or the Premier. At what point will you consider lifting some of the restrictions on businesses and gatherings?
Sorry, Rationale, I think the question was, at what point will we consider lifting more restrictions on businesses?
Yes, that's right.
Well, of course, we're looking at the epidemiology every single day, looking at the metric of hospitalizations and doubling time, the same metrics that we've been using before, of course. And I think one of the lessons learned, and Dr. Fitzgerald hinted to it in her opening comments from the past, and looking at other jurisdictions, is doing too much too quickly can cause significant harm. So moving in increments and adjusting those increments based on some of the metrics that we've alluded to is, I think, the appropriate way to move here now. So we will be looking continuously at the...
I do understand the idea of getting children back to school before looking at the alert level, but at this point, if the restrictions are doing more harm than good, why not allow, for example, the businesses that have been forced to close completely to reopen at a reduced capacity?
Well, first of all, we've always said that schools should be the last thing to close and the first thing to open. There's nothing more important than our children. But in terms of the epidemiologic rationale, Dr. Fitzgerald, I don't know if you want to provide a comment.
Sure, thanks. You know, we are trying to keep the spread down as much as we can, keep our contacts as low as we can. And that is really the only way to do that. Right now, we've tried to minimize as much as possible what is closed. But you know, unfortunately, the inevitability of it is that, you know, we have to make some difficult decisions. We will be reviewing it, as the Premier said, on a regular basis, and we will be looking at this. But if we open the tap too quickly, we are going to cause a flood. So we don't want to do that. And so we want to open that tap just enough so that we can keep the water flowing and it doesn't, you know, overflow the sink. And right now, with schools going back, that is an opening of the tap. And so we need to see what the effect of that is going to be. So that's where we are. And none of these decisions are easy and nobody takes them lightly. And we will be looking at them on a constant basis. And we will be, you know, making amendments as soon as we feel it's appropriate to do so.
And one quick example of businesses impacted that we'll be doing a regular update on is the change in the isolation requirements that you saw today for people entering the province. And our initial intention right now, depending on the evidence that evolves, of course, is that this would be in place for 2 weeks. And then we'd reevaluate and hopefully we can further limit the isolation of travelers entering the province at that point, again, depending on the epidemiology and what's happening in hospitals at the time.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi there. Yes, my first question is for Dr. Haggie, and that's speaking of opening the tap, so to speak. Will any additional healthcare resources be put towards pediatrics for the Janeway per se, just as schools reopen?
The Janeway does have a surge plan, a Code Orange plan as well. And we take the advice of the infectious diseases team there. So these are possibilities. Our current occupancy across the regional health authorities at the moment is actually 81%. So we do have some leeway. I don't actually have specific figures for inpatients at the Janeway at the moment, but there are preparations ready in case there is a surge.
Thank you. And my next question is for Dr. Fitzgerald, and that's Dr. Fitzgerald. Starting Tuesday, will we start to see more vaccination clinics being brought to schools?
So I think at this point, the regions are certainly looking at their vaccine plans, but the intention at the moment, starting off, is with mass vaccine clinics, so those larger clinics, to get as many people through those as they can. And then they will be focusing on schools. You know, they'll look at where they need to really focus their efforts. So if they have some areas where a lot of children have come in to the larger vaccine clinics, then they may not need to go into certain schools. So they really want to focus their school efforts where they're going to make the most, you know, have the most impact. They they went into some schools and had very few students, and then they went into other schools in the beginning and had a lot of students. So they want to make sure that they're, it takes a lot of effort to do a school clinic, and they want to make sure that when they do, they're being the most efficient that they can be.
I think, Ben, too, it's worth noting, as Minister Haggie said in his opening remarks, between 40 and 50% of students got their vaccines in school. So we do recognize that providing that choice, eliminating the barrier of accessibility is one of the best things that we can do to ensure that our number stays the highest in the country. It's less about acceptability and more about accessibility, and we think that continuing to provide it in schools is really important, and it's probably one of the reasons that we've done a bit better than some other jurisdictions. So that will certainly be built in, as Dr. Fitzgerald said, into the continued vaccine plan.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. My question is for Dr. Haggie. Have there been any deaths in long-term care during this latest wave of the Omicron variant?
We certainly know we have had people pass away from COVID in this Omicron wave. I don't actually have the details of where that happened. My understanding is the majority of these, if not all, were actually in acute care facilities, but I can certainly go back and check. Again, small numbers do provide a little bit of limitation because of the risk of people being identified and personal health information getting out there as a consequence. But we'll certainly see what we can find for you.
Thank you. And as a follow-up, we see other provinces publishing data on outbreaks in long-term care facilities, including like case count at each facility. Why don't we do this?
It's probably best for you.
We've
Minister.
been so good. Sorry.
No, I was going to say it's probably best for you, Minister.
Yeah. No, I mean, the facts of the case is we have such low numbers that identifying a particular facility with a case count or a death will lead to people being identified. And we have been, we've been very, very good, I think, at making sure that doesn't happen. We have to. I have a legal obligation as the ultimate custodian under the Personal Health Information Act to protect people's privacy. And I have said repeatedly here that much as I want to be open and transparent, as far as one can possibly do that, I will not do it at the risk of jeopardizing people's personal health information. And if you have one individual in a facility, that leads to people being identified, and it won't happen.
I will now go back through each reporter to see if you have one final question. Peter Jackson with the Telegram, do you have a final question?
Yes, this is another question for Dr. Fitzgerald. Most health experts now are in agreement that N95s are some kind of very well doubled up mask is really the only way of preventing spread of this virus or this new variant. Are you making any changes in schools on that front?
So we have recommended that schools would have either a 3-layer mask or medical masks. So we have not made that recommendation before we said a non-medical mask. So now we are being specific about the recommendation would be for a 3-layer cloth mask, fabric mask, or a medical mask of some type. So, if you're looking at a mask like this, like I have here, which you can purchase in the stores, this would be a 3-layer mask, and so would be considered acceptable.
Thank you.
Peter Cowan with the CBC, do you have a final question today?
I do. It's one for Dr. Fitzgerald. Give me an idea, what sort of numbers would you need to see, or what sort of situation would you need to see develop for you to make the decision that things have gotten too bad and we need to, end online learning again?
So I think well, first of all, as we've always said, schools will be the first to open, last to close. So ending online learning would not be our first jump. If we had to make different restrictions, then we would try to consider those first. So if we're looking at increasing restrictions or having to clamp down a little bit more, I think we would certainly be looking at, case counts to a lesser extent than we have in the past. We look at trends of case counts, but not, they wouldn't be our primary focus. We'd be looking at hospitalizations, healthcare capacity, other things that, we would look at how fast is the rate of rise in cases or hospitalizations, that sort of thing, to see if we need to, and the age ranges with cases. If we start to see suddenly there's a much older demographic that are becoming infected, then that might be more concerning than if it seems to be a greater proportion of younger people, just given what we know about severity. So all of those things, it's definitely a much more nuanced approach now with how we have to deal with things. It's not just, we're not looking at just case counts and our RT values and things like that. So we're getting regular updates from our modeling team, and we're looking at all of that information very closely.
Richard Duggan with VOCM, do you have a final question?
I do, and it's a question for Minister Osborne. Minister, I've received numerous comments and questions over the last little while about numerous daycare closures as the result of COVID cases. Minister, how widespread is this issue, and what do you say to parents and educators that I've heard from who don't think that enough has been done to protect them?
Well, thank you, Richard. First of all, I will point out that through health, we have secured the rapid test kits for our early learning and childcare, as well as the children in early learning and childcare, and the rollout has started on the distribution of those. That started today. So operations and centres should hear over the next couple of days about the instructions on where and how to get those. In terms of some of the closures, there have been closures. I think it mirrors the rate of infection in the community. It hasn't been alarming, but anytime there are cases, obviously you have to treat those and deal with them seriously. And we have, in terms of the operations, the educators who needed to isolate or the children who needed to isolate, or in some cases the centres themselves needing to close and isolate.
Rationale with All Newfoundland Labrador, do you have a final question?
Yes, it's a follow-up to a question I asked Minister Haggie earlier this week, although it's perhaps a question for the Premier or Dr. Fitzgerald. Digital Government and Service NL has confirmed that since December 20th, they've received over 200 complaints related to businesses not complying with public health measures. And that's led to dozens of orders being written by occupational health and safety officers. That's quite a big number. I'm just wondering how concerning that is.
We struggled a bit to hear the question. I don't know if you heard it, Dr. Fitzgerald. It's a bit of a breakup on the line there.
Premier, it was around the number of occupational health orders that have been written as a result of complaints to Digital Governance and Service NL. I'm not in a position to be able to speak to that because it's an enforcement issue and health doesn't do that, so I'm not sure I could answer it for sure.
Certainly I can't answer it at this particular moment in time, but I'm happy to endeavor and get the information for you.
Ben Cleary with NTV, do you have a final question today?
I do have one final question, thank you. And it's around the nurses union says there's some confusion with the number of patients hospitalized with COVID. They say the number reported by the province isn't an actual reflection of how many people are actually in hospitals with COVID. Is there a response to that today?
I can provide some insights there. We report cases of admissions due to where the primary diagnosis is COVID or a COVID-related complication. We are aware that there are others who are in hospital with COVID-positive tests, but in there for other reasons, slip or fall, a fractured hip, something like that. As of this morning, there are 55 COVID-positive patients in acute care facilities across the province. The only 20 of those are in because COVID is their first diagnosis.
Thank you.
Sarah Smelly with the Canadian Press. Do you have a final question today?
Yes, this is for Dr. Haggie. I've spoken to several people today who have family members in long-term care facilities. They say they don't have any information about what's happening inside those facilities. They don't know if there are outbreaks there, if people are sick with COVID-19, be them staff or residents. And they're extremely worried. What is your message to them?
There are staff in all regional health authority facilities who are available to take phone calls, and in instances where family feel they haven't got anywhere with that approach, they can go through client relations, and the numbers for client relations are posted on the website for each of the regional health authorities. But it's the unit manager or the facility manager who would be able to provide information to next of kin and family.
Thank you, everyone. Premier, would you like to make any final comments today?
Sure. Well, thank you all for joining us. And just a reminder to families with children in school, please make sure to get your rapid tests. And thanks to the district and school communities for such a smooth and efficient distribution to date. Remember, though, that tests are just one of the many measures in keeping our kids safe. We still need to do our best and follow the safety protocols. Also, of course, vaccine clinics for ages 5 to 11 are open.